Good afternoon. My name is Steve, and I'm going to be the host of today's Hangout. Joining us once again for our air quality Google Hangout today is Charlie Seyffer, an air filtration expert with Camfil USA, a world leader in the development and production of air filters and clean air solutions. Today we're going to talk about hospital emergency rooms and air filtration, a very important topic when one considers how many news reports there are about hospital-acquired infections and just the common belief that people get sick when they go to a hospital. Charlie, how are you today?
Good, Steve. I hope your day is going well.
Not too bad, not too bad. Anxious to get into the meat of this, so without any further ado, what are some of the problems people encounter with regard to air quality when they visit hospital emergency rooms?
Well, there's multiple things. I mean, the primary concern would be exposure. And your exposure increases as the volume of occupants with maladies and so on are in close proximity to you. And unfortunately, part of the nature of an emergency room is that people are there because they have a problem. But, you know, I don't know if you've been through that situation, but God forbid you've had to be in an emergency operating room area on a Friday or a Saturday night when, you know, the activity levels are high. You can imagine, I mean, you're in close contact with other people, you know, et cetera, and it should be a concern of anybody that gets into these areas. One of the other items that you have, especially in city areas, is you have indigent people that typically the way that they're serviced by the medical facility or medical profession is they usually go to emergency rooms. It's one of the biggest problems that hospitals have, that they can't turn anybody away. Unfortunately, these people living on the streets and so on, they've got some things that the rest of us, should be concerned about. And then there's other things such as Ebola and other unknowns that man has not dealt with yet. Right, and the emergency rooms in the United States have a very high concentration level as to what happens if an Ebola case or something along those lines comes to the city. In many cases now, there's part of the emergency room suites are actually set aside, and there's been training put in place for the medical personnel to identify, isolate, and inform. Those are three key words that the Centers for Disease Control puts out. Identify what the malady is, isolate the patient from the rest of the facility, and then inform the employees and the local staff as to what may be going on in that area. So emergency rooms are kind of like a city unto themselves, with all sorts of precautions in place to protect us, but we also should take precautions to protect ourselves.
Yeah, that's absolutely true. And you raised a couple of really good points. I was going to ask you about indigent patients because the trend now is obviously that's their first line of defense, whether they have the flu, their kids have a cold, what have you. And then on top of that, you mentioned the global economy or the global situation. People go from across the world, whether it's SARS or the Middle Eastern virus that's going around, they can spread very rapidly. And it's amazing how fast and how different things are now. What kind of filters are used to protect the visitors to the emergency rooms in hospitals?
Well, the normal areas of the emergency rooms are usually a MERV 8 filter as a pre-filter, and what that filter does is captures common things like bacteria and dust before they get to the coil part of the HVAC system that does the heating and the cooling. And that's primarily because there's a lot of water involved in systems in hospitals, and water is a breeding ground for bacteria, so they try to capture those before they get to the HVAC system. Downstream of the fan, there's normally what you would call a MERV 14 filter. And that filter is at least 73% on very, very small particles, 0.3 microns in size. So that's 1/300th of the diameter of a human hair. So those types of filters do a very good job of filtering particulate out of the air. Now, viruses are so small that that these filters cannot capture them, but normally viruses will attach themselves to other things, and that's the way we remove them. If we remove the larger particles, most of the time the viruses are attached to those particles. Sometimes they also have HEPA filters. In fact, this is becoming much more common, more of a concern for the employees than it is for the patients in those areas. Another consideration, Steve, that people don't think about, a filter is good as long as you move air through the filter. The common office environment typically has about 6 air changes per hour. Well, the fans in these emergency suite areas are very high level, and they can have 30 to 50 air changes per hour. So they've really increased the volume that goes through the air filtration system to try to move those particulate at a very high rate. And the last thing that I've got to mention is that medical facilities should be concerned about a filter's maintained efficiency. So not only should they be looking for filters with MERV 8 and MERV 14, specifically if those are the only filters in the system, they should be looking for what's called a MERV A. A filter should have a MERV 8, and it also should have a MERV 8A. The final filter should be a MERV 14 and a MERV 14A. And that A value, if those are the same values through both ends of the filter, it just means that that filter has that maintained efficiency. Some MERV 14 filters can drop as low as a 7, and that's not good for the occupants of that emergency suite area.
Yeah, that is important. And I know from previous Hangouts that Camfil filters maintain their efficiency 2 to 3 times as long as other manufacturers' filters, and I imagine that's important as well. Are some hospitals better than others with levels of air protection?
Well, like anything, newer seems to be better. Everybody wants to jump on the new iPhone or the new iPad or the new Microsoft computer or along those lines. The newer hospitals are well designed, and the engineers really take into account the current status of what's happening in the world today, as you were talking about with SARS and Ebola. So if you're capable of choosing, a newer hospital, you're probably going to be in better shape. In fact, the odds are they've probably got HEPA filtration in the ceilings in those hospitals. One thing that you can do to check out to see how your local facilities are performing is you can check a database that's published by the federal government. It's actually a requirement where you can go in there and look at the infectious transfer rate between patients within a facility. And the higher that rate is, the less proper hygiene is used in that hospital, and quite a possibility that they're not using the proper filtration either. Most hospitals are. 90% of the hospitals are doing the correct thing out there. Even Consumer Reports had an article that was published this last spring that lists hospitals by their infectious transfer rate. And of course, we want to go into a hospital and be cured, not come out of the hospital with something that we did not go in the hospital with.
That's absolutely true. So how about the waiting areas and access areas to the treatment areas? Because that's obviously important to people bringing people in, guests and the like.
Absolutely true. It's kind of interesting. One of the main things that we're concerned about in the medical environment is protecting the employees. Remember, it's always a factor of the number of particles that are in the air that may be infectious and the amount of time that you're exposed to them. It's called the Wiles-Riley equation, and everybody in the medical facility and medical industry knows how to do that type of math and so on. But usually in those areas, they're using a MERV 8 pre-filter and a MERV 14 filter. The negative is that the air changes are a lot less in those hospital waiting areas outside the emergency suites. So you should always take precautions. If you have a cough or a sneeze, cover your mouth. That's one of the best filters that are out there. People have been taught these days that you actually sneeze or cough into your arm, and that actually is a filter removing those particulates from the air. So, the real end of it is take proper precautions when you're in those waiting areas. And if you do that, you're probably going to be, just as infectious capable as if you were in a school environment or something along those lines. Not as safe as at home, but relatively safe.
Right. Any idea what MERV rating the crook of your arm has?
I'm hoping at 100% if I put it up there properly.
Okay. Where can our listeners find more information about hospital filtration, etc.?
Well, Camfil has a multitude of sites that you can go to, and they're all pretty easy to remember. There's catalog.camfil.us, there's camfil.com, and there's Camfil.us. Just look under industries and look up healthcare. We publish an 18-page booklet that's actually designed for the medical facilities. That's pretty well become the standard of the industry. In fact, ASHRAE writes a standard where they talk about minimum care. Our booklet takes it a little bit further and talks about not minimum care, but what should be done to absolutely protect the patients and the employees within the structure. And our booklet has become very popular. It's been published in the levels of tens of thousands, and most hospitals actually have that type of thing. The other thing that you can do is contact a local Camfil distributor or branch. There's 170 locations around the country, and they would be happy to provide information or just discuss whatever your concerns are with you on the phone.
Excellent. Thank you all for participating. We look forward to seeing you at our next Hangout when we cover more essential air filtration topics. Thanks again, Charlie. Always a pleasure.
Thank you, Steve. Be well.
Be well.